Alright, so now we have a T8 compression fracture. The first thing that we want to do is line it up in the lateral plane, set up the tower so we can get as true a lateral as we can, squaring the end plates above and below. You can see it's only mildly compressed, but that doesn't have any correlation with the patient's debilitating pain. So the next thing we're going to do is we'll move the tower into the AP plane. Look at it in the straight AP. And the vertebral body's in the straight AP, but as you can see in that picture, the pedicles themselves are above the superior end plate in the straight AP of this thoracic vertebral body. So then we will move the tower up, and borrowing a term, we will bring the headlights into the grill of the car. So now the entire pedicle, top to bottom, is surrounded by vertebral body. We'll angle off a little bit to bring vertebral body in on the side of the pedicle as well. So now we can see that the entire pedicle is surrounded by vertebral body on both sides, top and bottom. So if we go down the barrel of that pedicle using this approach, there's nowhere else for our needle to end up but within that vertebral body. So the next thing we're going to do is anesthetize the skin and the periosteum. Again, using the same approach that we're going to use with our needle. Following the angle of the tube and the image intensifier down, we drop right down onto the pedicle. Deliver anesthetic directly to the periosteum and again into the tract, and come on out. Because their pedicles are large enough, we chose an 11 gauge needle. This needle has a little bit different tip. It has what we call a pyramid. What's important about this tip, though, it's also ground down, so the cannula and the trocar are ground together, making the tip very, very easy to direct through bone, even tough bone. It also happens to be an excellent biopsy needle. So we'll make a little skin incision. So once again, we'll take a down the barrel approach. We'll drop our needle down till we hit bone, following the angle between our tube and our image intensifier. Drops right down onto the pedicle. What we'll do is we'll take the same approach. We'll access the pedicle so the needle will stand on its own but not commit it. And now we can address the angle a little bit that we want. Continually advancing our needle, trying to take a medial angle so that our tip will course through the pedicle but end up in the center of the vertebral body. Okay? So we're continually advancing. So our needle is about in the posterior third. Anteriorly, so we bring the cannula and the trocar anteriorly, accepting the fact that when we pull out the trocar, the cannula is not quite as far forward as we thought it was. We'll now go to a straight AP. And see that we've approached the midline with our needle, so we will accept that position for our cement delivery. All right, so now we'll take the cement, again taking all the powder, which contains both the monomer and 30% barium, which allows you to opacify the cement. Place it all in our mixing device. Tap it down. We will take the monomer Bring it in from the sides. So it trickles down and involves all of the powder. We'll then take our mixer, take a deep breath, and mix our cement. When we now pull the cement through, you can see that what was powder and liquid is now a paste pulling through the holes in our mixing device. And we're just trying to get a nice continuous mix of the powder. The plunger comes out, and in a reverse turn, on goes our syringe. The syringe is graduated, so it lets us know how much cement we've delivered. It's a macro plunger delivering 5 cc's of cement per turn, and then it will crack right now to become a micro plunger. Once again, now it's delivering 0.1 cc's per turn as we fill our delivery tube to the end. Take notice of the fact that when we stop injecting, cement does not stop moving through the tube. So it's important, if you want to stop the flow of cement, you need to release the pressure by back turning on the device. Just dropping it on the table does not stop the flow of cement. So we bring it out, see that our cement beginning to achieve the consistency that we want. Which is more of a paste as opposed to just a white liquid. Take out our trocar. Make sure we like our position. Attach our cannula. Slowly, under continuous visualization, we will bring the cement down, appreciating the fact that the needle holds about 0.7 cc's of cement, so it'll take about 7 turns to begin to see the flow of cement in the needle as it comes down, which is what we're seeing right now. We have cement at the needle tip, starting to fill the vertebral body, nice and slow. So now we'll continue to deliver the cement a little bit. Take a look at it in the AP plane, just to make sure it's filling the vertebral body where we want, which it is. Continue to fill, and you can see the nice bloom of cement in that vertebral body. And the vertebral body is filling back to its posterior half. We're just at about the midline. Back off a little bit now. We'll check again in the AP plane. We'll see we're getting a nice fill of cement on both sides of the midline. We'll fill a little bit more. Again, appreciating the fact that we still have 0.7 cc's of cement inside our needle that we could choose to deliver. So we've achieved a nice deposition of cement in the anterior half of that vertebral body, which is where we want it. We've placed about 4 cc's of cement in based on our graduated cylinder, and now we'll remove the needle. There are several ways we can remove it, knowing that we have room in our vertebral body for a little bit more cement to be deposited safely. We'll plunge the needle. We place our tip in, plunge the needle gently, where we're advancing and delivering that last 0.7 cc's. We see our cannula coming down, the trocar coming down the cannula. And now we'll remove it. We'll bring the needle tip to the back of the vertebral body, to make sure we're not pulling cement back with us. Rotate it once. We see we have a clear avenue. And then we remove the needle, again holding pressure over the back of the pedicle for 20 to 30 seconds to stop the bleeding. We have a nice deposition of cement in this vertebral body, and we'll take some images for posterity.